this next company, I've got my eye on them. Yeah, that was a pun. You'll find out why in a second. Alimera Sciences. Let's bring on Rick Eiswirth. He's the president and CEO. There he is. Rick, good morning. How are we doing today?
Good morning, Spencer. How are you?
Doing well, doing well. I see your slides. We'll get them up on the screen here. And you guys are also focused on the eye, which, I've got my eye on you. Okay. All right. I'm going to see myself out, give you the floor, and no more puns from me.
Great. Thank you very much. As Spencer said, the company's Alimera Sciences, and I'm Rick Eiswirth, the president and CEO. Our focus is retina disease, so treating diseases of the back of the eye, as Spencer mentioned as well. Oops, sorry, having a little trouble with this slides here for a moment. There we go. Skip through the forward-looking statement language. We've got a very unique asset, Iluvien, which we believe is really a better mousetrap or a better way to treat disease. And we're trying to change the treatment paradigm and the way diseases in the back of the eye are treated, because Iluvien is the only non-acute or durable therapy that doesn't treat the disease episodically, but rather reduces the recurrence of the disease and stops it from coming back. So we're very pleased with that asset, and I'll tell you a little bit more about that as we go. We already have a very established commercial business. Pre-COVID, we did about $54 million, and we're break-even EBITDA in 2019. In 2020, despite the challenges of COVID, our revenue was off, only 6%, and we still did over $50 million in revenue, and we're positive EBITDA. And we've already built what we believe is a pretty leverageable commercial platform. Uniquely, as a small company, we've got a commercial presence and infrastructure in both the U.S. and in Europe that we think we can leverage going forward. In addition to the ongoing commercial business, we believe we got some of that more exciting option value, and that we are doing a head-to-head comparison in what we're calling the New Day study of our drug Iluvien versus the $7.5 billion standard of care that's out there in the treatment of diabetic macular edema. So as you can imagine, if we do pretty well in that trial, there's a lot of upside to our current $50 million or so in revenue. And our vision is to make Alimera what we call the place to be in retina. Again, the focus is on the back of the eye. To give you some perspective, there are about 20,000 ophthalmologists in the United States, but only about 2,000 of those focus on treating retina disease. And most companies that are out there treating retina disease also have products that treat the front of the eye. And so because there are so many more front of the eye specialists, they get the majority of the time. There's no company out there that has more than one product to treat retina disease. And so we really want to build a company around the retina specialist and their patients. And we think there's a unique opportunity to do that. And frankly, we could do that very profitably because we've already got the infrastructure in place and are already making money, in that space. So anything we add would certainly be additive to the bottom line. Our primary focus to date has been a disease called diabetic macular edema. It is the leading cause of vision loss in diabetic patients. If you're familiar with diabetics and how diabetics get swollen hands or swollen feet, that typically is a result of leaky blood vessels in their appendages. That same thing happens in the back of the eye. The blood vessels in the retina start to leak. Fluid builds up. You get swelling in the retina. And for lack of a better way to say it, the movie screen in the back of your eye starts to lose its shape and the picture gets blurry. So very, very debilitating and suffered by quite a few diabetics. It's very important to think about how ophthalmologists, treat disease versus how physicians treat chronic diseases and other disease states. Ophthalmologists typically treat retina disease, although they are persistent and chronic, they're not going away. They treat them with what I call acute injections or short-term injections. They treat them, with an injection every 30, 60, or 90 days. Everybody's trying to find durable therapy in ophthalmology, but it's very, very limited to those acute therapies with the exception of Iluvien. Conversely, if you think about another chronic or persistent disease like high blood pressure or hypertension, the cardiologist treats that disease consistently every day with a systemic dose of drug to control the disease and stop it from coming back. You don't treat blood pressure once a month, once every 45 or once every 60 days. You treat it every day. And you certainly don't get it under control to, say 110/70 and tell the patient to go home and come back when they have high blood pressure again. Yet that is basically what is happening in ophthalmology. The disease is treated. You'll get a temporary improvement in vision, but the drug wears off, as I said, once every, 1, 2, 3 months, and the patient has to go back in and be treated again. So there's a very, very high burden on the patient because of that recurrence of the disease and constantly going back to get treated again. This is an example here, and this is a great takeaway for the problem in ophthalmology and the problem in treating, DME specifically. This is a patient that has been treated for quite some time on, again, what I call the acute therapies. The bluish purple line is looking at the anatomy. So how thick or how swollen the retina of this patient suffering from DME is. And to give you some perspective, if you look at the scale on the left, a normal retina is 200 to 300 microns thick. So you look at CRT microns there, that central retinal thickness, and 2 to 300 microns is normal. This patient starts off with a retina that is more than 800 microns thick. So very swollen, very edematous. They get one of the short-term treatments. Every one of those arrows is one of the acute therapies. And you see a pretty rapid resolution of the edema. The swelling goes down. However, the drug wears off and the edema comes back. And you get this constant seesaw pattern, allowing the disease to sort of wax and wane over a period of years as those injections, take effect and then wear off. What's very important is we believe that every time the retina is allowed to swell and then comes back to normal and swell again, the damage is constantly occurring in the retinal fiber layers, which impacts the vision longer term. And the way you see that in this chart is that yellow line is looking at the functional measurements, or the visual acuity, how well the patient is seeing. And you can see this patient starts off at about 2200 at the beginning. They get periodic improvements in their vision, as high as 2080. And it kind of matches at the beginning the improvements in the anatomy. As the anatomy gets better, the vision gets better as well. But as you get further and further out to the right, you'll see that you continue to see improvements in the anatomy, but you no longer see the same improvements in vision. And we believe that's because that damage occurs over time. And so the idea is we need to keep that retina flat consistently, stop the disease from coming back, and provide, that longer term protection. And that's where our product Iluvien comes in. Iluvien is that little yellow tube, polyamide tube that's sitting there next to the tip of the pencil to give you some, framework or feel for its actual size. It's 3.5 millimeters long, 0.35 millimeters in diameter. And so we've done this. If you superimpose that in a grain of rice, you could actually fit 32 of those inside of a grain of white rice. So it's very, very small. You have to wet your finger to pick it up. That polyamide tube is impermeable on all sides, except one end is left open, and it slowly releases a corticosteroid called fluocinolone acetonide every day for up to 3 years in what we call continuous microdosing. And the idea is to mimic that daily systemic dose, that consistent therapy that hypertension patient gets by taking a daily dose of an ACE inhibitor or a diuretic or some other type of cardiology drug, again, to prevent the disease from coming back or give them a greater disease-free recurrence period of time. This is an example of how it works in a clinical setting. This is looking at the user study, which was a retrospective look at about 4 clinical sites that used the most Iluvien after it was first launched a few years ago. This is looking at about 130 patients and 160 eyes, so about 20% of the patients were actually treated in both eyes. And what we did is we looked at how these patients were performing from a visual acuity standpoint, from a frequency of treatment before they got Iluvien, and what that looked like after Iluvien. So that dashed line in the middle is looking at when they received their Iluvien. We call that baseline. And then this is segregated based on how well the patients were seeing on those other acute therapies. So, how well they were doing, because we don't believe that, Iluvien should only be saved for the patients that are doing, badly on the other therapies, that it really is appropriate to get as many patients on board with this, daily maintenance therapy as you can. So looking at that green line, those patients were seeing very well. They were seeing 20/40 or better. That's basically driving vision. And they were being treated about once every 2.9 months with the acute therapies. They got Iluvien in the eye, and they maintained that very high quality vision of 20/40 or better. But the recurrence of the disease was significantly reduced, and they went to being treated once every 22 months. So more than an 85% reduction in treatment frequency. Conversely, if you look at the bottom blue line, these are the patients that were arguably, failing on the acute therapies or short-term therapies. Interestingly, they're still being treated once every 3 months. And that's because these are diabetic patients. They have so many other comorbidities. They cannot necessarily get back into the office to see the doctor as frequently as they should. And the doctor's offices are overrun with injections. So the doctors can't necessarily see the patients as often as they should either. So you're not able to customize that therapy as much as you can. And these patients are, all being seen, about once a quarter, despite the need for maybe more frequent therapy in some of the cases. These patients were seeing 2200 or worse. So very, very debilitating vision, obviously can't drive, need a caregiver to help them get to and from the office. And they got Iluvien in their eye. And they saw 4 lines of visual acuity improvement on the eye chart, or 20 letters. So if you're familiar with the eye chart, you've looked at it in an optometrist or an ophthalmologist's office, that's the equivalent of 4 lines, so a pretty material improvement in vision. And their treatment frequency or recurrence of the disease was more than cut in half, went to about every 7 months. So sort of the takeaway here is, get Iluvien in the eye because you're going to reduce the recurrence of the disease no matter how severe the disease is. You're going to reduce that treatment burden for both the patient and the office, and you're going to give patients a chance to either improve or maintain their vision depending on how well they're doing on the acute therapies. So it really provides a benefit getting it on board earlier. That's where we're trying to shift the paradigm, as I said. A lot of people ask if Iluvien works for 3 years, why does a patient need to be treated every 7 months or every 22 months? It all depends upon the severity of the disease. Just like cardiology, again, some patients, need 5 milligrams of an ACE inhibitor to treat their blood pressure. Others need 10 milligrams of that same ACE inhibitor. And some people need, combination therapy, an ACE inhibitor and a diuretic. So there's varying degrees of severity, but the majority of the time, and 63% of the cases in the user study we just looked at, Iluvien worked as monotherapy and the patients did not need anything else added. And about a third of the cases, they were more complex and they need to be supplemented with other therapy, but a lot less frequently than they were being treated before. So again, Iluvien works very, very well to reduce that recurrence of the disease, stop the disease from coming back, or reduce the need for additional therapy in a lot of the patients. Strategically, we continue to have a big opportunity to grow. I mentioned we've got a very successful commercial business, that pre-COVID was generating over 50 million in revenue and positive EBITDA. We think there's a lot of opportunity for continued organic growth, getting new physicians to use the product and getting it used earlier in the treatment paradigm. We are continuing to expand geographically. About a year ago, Iluvien was available in 11 or 12 countries. It's available in 17 or 18 now, and we've continued to emphasize our geographic expansion, during the COVID pandemic. We think that's a very, very important, thing for our future growth, and that, our platform, uniquely being a small company, but having access to Europe and the US as markets, we would make a great partner for anybody else that wants to launch a product in this space. So we continue to try to expand the geographic footprint, because we think it adds value in multiple ways. We have a new indication. We were approved in 2019 in our European markets for a disease called uveitis. It's a smaller disease state, probably about 15 to 20% of the incidence of DME. However, it does not have a lot of other available therapies. It's usually treated with high doses of systemic steroids or autoimmune deficiency drugs. So there's a big opportunity there. And that product's only been launched in 2 markets so far because of the COVID slowdown. And then our New Day study, as I mentioned, we think this could be a big inflection point if we get the data we believe out of the New Day study. And I'll talk a little bit more about that. Just giving you a quick snapshot of our footprint. Iluvien is available in the United States, where we sell it direct from a commercial perspective. We also sell direct in the United Kingdom, Germany, Portugal, and Ireland. We have partnerships across Southern Europe and Italy, Spain, and France. We have recently expanded some of those partnerships to cover the Benelux territories. And we are in the process of, launching our product, directly in the Nordic countries in the coming months. We also have a partnership in the Middle East that we're continually expanding. And back in April, we actually out-licensed our product to a company in China. So continue to expand that footprint. The China deal was a big transaction for us. We actually generated about $20 million in cash, $10 million in an upfront license for the product, and a $10 million equity investment from Ocumension, our partner in China. We're also eligible to receive another $89 million in milestones, over the life of that transaction. So very excited about that opportunity to raise some capital pretty efficiently which we expect to continue to invest to continue to grow the company, coming out of COVID. But a big opportunity there for us to raise capital as we expanded our footprint earlier this year. The uveitis indication, as I mentioned, our label there is for the prevention of the recurrence of the disease. So very, very on point with the way we position our drug for diabetic macular edema. If you look at the data in a 36-month trial, the mean time to the first recurrence of uveitis in the control arm, so the patients getting those systemic steroids and other autoimmune drugs, was about 10 weeks. So about 2.5 months into the trial. Whereas the patients on Iluvien, the mean time to the first recurrence or flare-up of their uveitis, the inflammation in the eye, was 94 weeks. So almost a 10-fold improvement in that disease-free recurrence period of time. So keeping that disease at bay, keeping the eye quiet for a much greater period of time than before. And if you look over the course of 3 years, this is a disease that comes and goes a lot. The mean number of recurrences in that control arm was over 5. So, patients experiencing more than 5 flare-ups on average over the course of 3 years. In the Iluvien arm, that was reduced to less than 2. So again, a 65% reduction or so in the recurrence or the number of recurrence of the disease. This is a big opportunity for us going forward again, because there's no headwind, as I mentioned, of other drugs in the space. It's only been launched in Germany and the UK, and we are preparing for launches across the rest of Europe at the end of this year and into 2022. Been delayed slightly because of COVID. And then the New Day study. And the New Day study is something we're extremely excited about here. I have believed for quite some time that Iluvien should be considered as, first-line baseline therapy for every patient suffering from DME, to get something on board to treat the disease consistently every day. I think the COVID environment has really highlighted the need for that, because patients have not been able to get back into the doctor's office as frequently as they'd like to. And frankly, when they've been treated with these acute therapies and those drugs wear off, because their visits have been deferred, they've been coming back with worse vision than they, have seen before. So getting something like Iluvien on board to know that they're being treated, even when they miss visits, is critically important. The New Day study is a head-to-head study. It's the first ever comparison of a corticosteroid therapy versus anti-VEGF therapy, which is the standard of care, as I mentioned. It'll be an Iluvien arm versus an Eylea arm in our study. And we believe we will demonstrate a significantly reduced recurrence of that disease. And we think as a result of that reduced recurrence that you will see better visual acuity over time as well. We're also doing some groundbreaking cytokine and electroretinograph studies as well, to ultimately show why Iluvien works the way it does. It is planned to be an 18-month study with about 300 patients across 40 sites. And, I'll tell you, although this is an exploratory study, we have very, very high hopes for this and a lot of confidence in the results, because we aren't going from phase 1 to phase 2. We've treated about 40,000 patients around the globe already, so we know how our drug works, and we know how our drug works as we planned out the study. So in closing, again, very unique asset. We think it's a better mousetrap, and with it, we're trying to change the paradigm in the way DME and uveitis are treated as the only non-acute therapy. Very established commercial business with a platform we think we can leverage going forward. A lot of upside in the option value of the New Day study. And again, our goal as we continue to build these relationships with retina specialists is to build Alimera into a unique company centered around the retina specialists and their patients. Thank you very much.
Thank you, Rick. Again, President CEO, Alimera Sciences. Yeah, thank you. That was great stuff. Fantastic. Thank you so much for coming on today on the Benzinga Small Cap Healthcare Conference. Appreciate it.
I appreciate it, Spencer. Thank you.